Thank you for the nice introduction. Yeah, so I'm talking today about the reproducibility in dual energy CT, but let me start with the motivation for this topic. So reproducibility of CT numbers represents an ongoing challenge, but it is important to address this challenge in clinical practice because there we try to assess the disease progression or the response to therapy. Typical examples would be the lung nodule density measurements for lung cancer patients and emphysema scoring when you suffer from COPD. Dual energy CT now offers the opportunity of improved reproducibility using monoenergetic images, because here the attenuation is more correctly modeled with 2 basis materials instead of 1. And this leads to reduced or eliminated beam hardening effects. The focus of this work is now that we try to assess how dual energy impacts the reproducibility of Hounsfield unit values. And this assessment is based on monoenergetic images, and we compute that in 2 different ways. So we use either material, or we do both. We do the material decomposition in an image-based approach, and then second, also in a data-based approach. So I use this name, but it means that we do the material decomposition in the projection domain. So it's the projection data. And for the reproducibility, here we evaluate that with a phantom in 2 very specific contexts. First, it's the reproducibility across time, where we look at the scan repetition on another scanner with a 3-year time difference. And then as a second part, we look at reproducibility across positioning, where we change the positioning of the phantom in a given scanner. But before I talk about the experiments that we did, I would like to briefly walk you through the steps of the material decomposition approaches that we applied or implemented. First, the image-based material decomposition approach. So here you rely on calibration measurements, and these measurements need to contain the materials you use for the decomposition later. So in our case, or here what we have used in the first step, you reconstruct the high energy and the low energy scan data separately. Then you select 2 ROIs that each contains only pixels from the specific basis materials. You calculate the mean within those ROIs, and then you compute the ratio of the means. And this ratio you can use to identify an effective energy by comparing the computed ratio to the theoretical correct value that you know because you know the materials for the decomposition. And when you have this effective energy, you can assemble your matrix A here that consists of the linear coefficient mu of the for the 2 different basis materials at the effective energy for the high and the low energy scan. And the decomposition is then simply performed on a pixel by pixel way by applying the inverse of this matrix A. For the database material decomposition here, this is an approach that we have previously introduced at last year's MIC. So in our case, we assume identical geometry for the high and the low energy scan, and we also perform an object-specific scatter correction before we do the material decomposition. So with this approach, we don't need calibration measurements, but we need knowledge of the spectrum of the system. And this is the information of the source spectrum and the detector response that is combined in this analytical energy response model. And if we know that, we can compute the energy dependent forward model or projection for that for the high and the low energy data. And we do that to create a lookup table. And this lookup table connects the length of the basis materials for the decomposition and the simulated scatter-free polychromatic data. And the decomposition is then simply performed by using this lookup table to transform the measured data to the monochromatic data. Okay, so let's look at the experiments that we did. These are the parameters of our scanner that we use. It's always a 360-degree scan trajectory with no table motion. And maybe I just want to point out for the high and the low energy scan, we have this pair of 120 and 80 kV. For our measurements, we use the ACR CT accreditation phantom. In the module A, it contains 5 cylindrical inserts representing the materials of bone, polyethylene, acrylic, air, and water. And we do the scans for the high and the low energy scan one after the other so that we can guarantee matched geometry for both scans. And just one note, we repeat the scans 10 times and then average in the results to mitigate the noise so that we can see artifacts a little bit better. So the baseline scans were carried out in 2018. And so you can see we have placed the ACR phantom here in a centered position. For the material decomposition, we have selected the water and the bone equivalent material as they are given in the for the definition of this phantom. And for the reconstruction, we've used an FBP implementation from Siemens. Now to the experiments on the reproducibility. So 3 years later, we went back to the scanner. It was now a different scanner model, but with the same geometry. We only have very small changes in the bow tie filter, which is mainly important for us to consider that in the different source spectrum for our projection domain decomposition. And the phantom was the same, and it was placed again in a centered position. For the experiments on the reproducibility across positioning, we've then changed the position of the phantom. It was shifted off-centered around 5 centimeters vertically up. And then to have another position, the phantom was rotated by 45 degrees in a counterclockwise manner. Yeah, and that gave us a second position. The material decomposition and the reconstruction were performed in the same way as the baseline experiment so that we can compare the results. And speaking of the results, now we can look at that. So I start with the baseline results. So here on the left-hand side, you can see reconstructed images of the high and the low energy scan. And when we now compute the image-based decomposition, this is the result here, exemplarily shown for the 70 keV energy. And now I'm discussing a little bit the artifacts that we see, or the most prominent ones. And this is, for example, here the streak artifacts originating from the bone insert going down to the air. And you can see that this is already part in the original scan. So with the image-based decomposition, we kind of stick with these artifacts. It's very difficult to reduce that. And also interesting what we've learned. So the ACR phantom has 4 small metal beads that are normally used to help with the positioning of the phantom. And it's also high attenuating materials. And you can see streak artifacts here at those locations. And you can also see that in the original scans. When we now look at the database decomposition, you can see that exactly those artifacts are much reduced. So the main streak artifacts between bone and air is almost gone, and also the streaks originating from the metal beads are reduced. Okay, to show you a little bit that both approaches are implemented in a correct way, or how exact they are, I have here quantitative measurements in physical units for the 5 materials. And you can see that the deviations that we've measured in absolute differences relative to the theoretical correct value for that for the linear attenuation coefficient of the specific materials is always lower than 4%. So we kind of feel good with those results. So now it's time to look at the results on the reproducibility. So I keep here those the results for the baseline scans from 2018. The image-based decomposition is always on the left, the database decomposition is on the right. And here the results then from 3 years later. And the images look very similar. So we have registered the two images and subtracted them. And here's a difference image. And you can see that we don't really see major differences within the inserts, or also in the place of the streak artifacts, for example, here between bone and air. And in addition, we have calculated here the mean values in the ROIs, and you can also see that those differences are below 3 Hounsfield units. So this is really nice results that we can say, okay, reproducibility across time works fine for this phantom here. Now the results on reproducibility across positioning. And so here we have the results from 2021 at the top that we've already seen. And now we have the shifted up phantom at the bottom. And you can see that the artifacts here have changed now. So around the bone insert, it's now bright and dark, so quite different than before in the image-based decomposition. But for the database decomposition, this is very stable for this shift in positioning. I've also highlighted here some ring artifacts that we start to see, but I just wanted to say that this is probably just because we have those 10 repeated scans. So normally this would be hidden by the noise. Okay, now we keep the off-centered positioning of the phantom. This is now at the top. And now we additionally rotate the phantom. You can see that here. And so when we focus just on the beam hardening errors around the bone insert, I can show you in the next slide that this artifact has actually changed a little bit in the orientation. However, with the database decomposition, this is still very stable, what we get here as a result in the monoenergetic image. Okay, yeah, so one more analysis quantitatively. This is now a bit complicated. So what did we do? We have here the bone insert, and we selected 360 very small ROIs around this bone insert. And then we calculated mean values within those ROIs to create a profile plot around this bone insert. This is the plot here, but we don't show the mean values. We show the differences towards the baseline results because it's about reproducibility here in our study. And what you can see when we repeat, so this is the result for the image-based decomposition. When we repeat our measurements 3 years later, the values here are very, very stable within -5 to 5 Hounsfield units. But as soon as we start to change the positioning of the phantom, we off-center it. We have here this sine-like wave pattern that we get -20 Hounsfield units to +10 or 12 Hounsfield units deviation. So not really nice. And when we now rotate the phantom, we can see that this sine wave has shifted a bit. And I forgot to mention that the images before calculating the differences were registered. So there is really a small change in the orientation of those streak artifacts that we now have quantified here. When we compare that to the database decomposition, we can see that for changing the position of the phantom, we reach a much more stable result and therefore a much more reproducible result. And to give you the whole picture, I've repeated that calculation around the air. And here you can see that the advantage of the database decomposition is not there anymore. Now both approaches achieve similar good results. Okay, so now it's time to conclude. So what did I just present? I presented a phantom study to investigate the reproducibility in Hounsfield units of monoenergetic images obtained through dual energy CT. And we specifically investigated scenarios that included changes over time in scanner, as well as changes in the phantom positioning. We did that in two different ways. So we get different ways to achieve the monoenergetic images, and we selected an image-based and a previously introduced data-based material decomposition approach. What we now learned from the results is that there is a strong reproducibility across the time for both image and database decomposition approaches, but only the database decomposition yields images with less beam artifacts. And that means that it's much more robust against changes in positioning. For the future, we would like to extend our database material decomposition to the helical scan trajectory. And what we've not considered here in this study is challenges for the reproducibility due to patient motion or the imaging with contrast agent. And with that, I would like to thank you for your attention.
Thank you for the nice talk. With your raw database decomposition, you were mentioning that you are doing a scatter correction. Is this correct?
Yeah, that's correct.
So how much influence does this scatter correction have on your sinusoidal curves, which change when you rotate the phantom a little bit and when you move it up and down or so? Did you check that, or can you switch it off and find out how your plots would look like with a better scatter correction?
Yeah, so it's an interesting question how this is impacting the artifacts that we saw there. So we have not only looked at the scatter estimation, how it changes for the positioning of the phantom, but it's a rather what our method that we use. It's rather simple because we just have understood that it's necessary. Otherwise, the forward projection model would not work because it assumes scatter free data. But it's just a row-wise estimation for scatter with two simple parameters. So yeah, it's very simple, so that everything works after that. But I think that this is something that can definitely be improved.
So I'm asking because I just wonder about this positioning effect.
Yeah.
Of course, it's well known for a long time that you have beam hardening artifacts not going away when you do the image-based decomposition, but you have to go to raw data domain.
Yeah.
So that's why I was wondering about the positions. And actually, the position effect mainly changes the scatter, but also due to the bow tie, you might have a little bit different X-ray spectra.
Yeah,
but it would be interesting to see which effect of these two is the dominating, which makes your sinusoidal curves, for example, differ and so on.
Yeah. I know from other experiments that we did that you have changes in our parameters, our scatter parameters, when you have a larger object, or also when you change that. But I did not look here for this experimental setup how exactly that is changing.
I have another question.
Yeah.
You're doing the study for dual energy CT here. So have you ever considered to do a multi-material beam hardening correction on single energy CT and see how the reproducibility is there?
Yeah, that was not really just in our scope, but I agree that's also a very interesting topic.
Because I'm asking, yesterday we heard a talk about temperature estimations through CT, and it was claimed that you need to have dual energy CT in order to get good density values.
Yeah.
And now you claim a similar thing, and I believe that you can get a good density value also with single energy CT if you do the corrections very well. And I'm still not talking about these beam hardening artifacts. That's a different issue. But if I want to compare how to reproduce density values or how a temperature slightly changes the density, I'm not convinced that you really need to have a spectral information.
Mm-hmm.
So that's why it would
I
be
see.
interesting to see if your beam hardening correction might help and to also do this for a single energy.
Yeah, I agree.
Nice work. Thank you.
Thank you.
One more question.
All right. So I saw you did 2 consecutive scans, 120 kV, 80 kV.
Yeah.
And for the image-based method, the clinical, the dual source dual energy scanner, they actually using 140 kV, 80 kV on the flash scanner with a thin
That's
filter, and 150 once you got to the got false scanner, right? So I think the spectral separation has a big impact on this whole thing, right? And anecdotally, I think the clinical scanner, when I look at ACR phantom, you might notice some artifacts. I didn't really see that severe as what you show here. Can you comment on that?
Yeah, it's a good point. So to choose this pair of 80 and 120 kV is a more challenging scenario, right? Because you have the spectrum is less separated as you would do normally in the dual energy setup with 80 140 or even 80 140 and the tin filter, for example. Yeah.
Thanks.
Let's thank the speaker again.